everyone. My name's Beth Tronolo, and I'm the chair of the Dental Hygiene Department. I'm very excited about dental hygiene and dental assisting, so I'd like to take you through our programs here at Owens Community College. So as soon as I can get this to work, oops, there we go. All right, my mouse is a little touchy. So I'll tell you a little bit about the practice of dentistry. Most dental offices in Ohio are owned by a dentist, and they employ a dental hygienist and a dental assistant. So you can see by this flow chart, I'll go through the dental hygienist first. The dental hygienist gets an Associate of Applied Science degree here at Owens Community College. They can go on, if you look in that little brownish colored box, they can also get an Expanded Functions Dental Auxiliary certificate, or they can also become a dental hygienist and get an Oral Health Access Supervision permit. So the dental hygienist does work for the dentist. The dental assistant works with the dentist in the same room. They're handing and assisting the dentist. And when they're done, they can take a state exam and become a certified dental assistant. Once they're certified, then they also can move on to that brownish box and become an Expanded Functions Dental Auxiliary. But they do have to have that state tested exam or the dental assistant national. I'm going to move on and talk a little bit just about what is a dental assistant. The dental assistant assists the dentist. You can see the dental assistant is standing with a suction in that picture. The dentist is sitting down and doing a procedure. They're going to set up the equipment. They're going to prepare the patient for treatment and keep records. They're going to clean this room and disinfect it. And now you can see we wear a lot of PPE because of COVID. Not only are we going to have safety glasses, but we also will have a face shield. So we teach all of that so you can feel secure in working. Oops, sorry. I'm going to show a little video of some of our dental assisting students because this is the really fun part.
What I like about the dental assisting program at Owens is that we get to have a lot of hands-on experiences and we get to work side by side with the dental hygiene students.
A dental assistant's duties range from scheduling appointments to assisting during different procedures with the dentist.
Some functions of a dental assistant include maintaining infection control, sterilization, taking impressions, and taking x-rays.
Dental assistants work in a lot of different environments such as periodontic offices, orthodontic offices, and pediatric offices.
Here at Owens, we offer a one-year certificate program where you are able to get a job right out of school and work as a dental assistant.
After the certificate program, you can come back to Owens and get your EFTA, which is Expanded Functions Dental Auxiliary, which allows you to place fillings and sealants.
I feel more prepared by going to Owens for the dental assisting program because it offers hands-on experiences with the dental hygienist.
The Owens dental program has really prepared me to go work side by side with the dentist, and I feel really comfortable going out into the field.
So I love showing the videos, and that particular video is on our webpage, and you can access that and watch it again and show others. There's another video, but you can click on that link yourself. So the duties of a dental assistant, they're going to assist the dentist with treatments and procedures. They're going to take and develop dental radiographs, which are x-rays, and then they need a special certification. We teach that class, and by the time they go to their practicum, which is, I'll explain a little later, they actually work as part of the certificate in a dental office. They can actually take x-rays right then. They're going to communicate with a patient. So it's someone who likes to work with someone, help them explain the procedure that's going to happen. They're also going to tell the patient after the treatment, you know, your area is going to be numb, don't bite your lip. They're going to explain all of that. They're going to prepare and sterilize instruments and equipment. They're going to perform laboratory procedures, and they're actually going to perform reception and office management procedures. And these are all the duties we teach in our program. There's other duties too. Dental assistants have a flexible schedule. Although most dental assistants work full-time, about a third of them work part-time, and sometimes they job share. So if you like having contact with people, you get to take blood pressure readings. And besides just doing dental assisting and working side by side with the dentist, you also could move on and become a dental office manager. You can become an educator, come back to Owens and teach with us here at Owens Community College, or you could go into dental product sales. If your interest is in dental product sales, you probably will need to finish your associate degree, and some dental product sales want a bachelor's degree. So just different things that you can do and expand your career. So the dental industry outlook is really, it's very good right now. There are 346,000 jobs in Ohio from 2018. The median hourly rate, now this is the middle rate. When you come in, you're going to start in around between $13 and $15 an hour. If you get certified, you can get $2 an hour more. So we always recommend that you get certified. And over time, you can, as a experienced dental assistant, you can make $19 an hour and even upwards. So the annual salary, median salary would be $40,000. And there's a 11% growth rate, which I think actually right now, because of COVID and a lot of older people leaving the profession, it's actually almost doubled. Oops, I went the wrong way. So dental assistants mostly work in dental offices. Some can work in an office of a physician, and some work for the government. There are also public health jobs, so you can work for a health department if they have a dental clinic. So there are some other things that important qualities of a dental assistant. They need to be detail oriented. The dental assistant must follow up and write down charting information, infection control. They're going to help your patient as a patient. The dental assistant must be able to work with your hands. You're going to work in tight spaces, and people have all sorts of sizes of bodies, but you're using small tools and trying to hand these instruments to the dentist. You're going to have some good interpersonal skills where you can talk to patients. Most dental assistants are on the quieter side, but they do work with the dentist and they need to communicate with them. The dentist usually will talk to the patient, but there are procedures that after the dentist leaves, the assistant will have a chat with the patient. So you have to have good listening skills, pay attention to the patient and other healthcare workers, and you need to follow the directions that the dentist provides you. Some dental assistants help dental hygienists, so sometimes you're working with the hygienist as well. So you're going to be treating the patients, doing tasks, and taking x-rays. And then you also need to be organized. You need to have excellent organizational skills, and you need to understand the order of the tools that the dental instruments that the doctor's going to need. So you're going to have to hand those instruments. We go over all of that. We have protocols for different procedures. So that's why we say you need to be organized and detailed. So there's a lot of growth opportunities. So I'm not sure if you can see my cursor up here. If you become a certified dental assistant in Ohio, to be a certified assistant, you need to take a state exam, or you can take the Dental Assisting National Board. That's an online exam. We talk about this in the program. But this allows you to get a big increase in pay, and with the state laws in Ohio, you have increased duties that you can do. Once you're a certified dental assistant, you could come over here and become an expanded function dental auxiliary. As the students said in the video, you're able to place fillings. And so we do have some of our dental assisting students come back into and take that course. That's through our workforce programs. It's not an academic course. Now, some students, if you want to go on and do something in selective admissions, you can also apply to the selective admissions to become a dental hygienist. And we do a dental hygienist. I'm a dental hygienist, and we do preventative care. And we'll talk more about that in the next part of the slides. So who does a dental assistant work with? Primarily, you're going to work with the dentist, the dental hygienist, the front desk staff, and sometimes dental specialties. So if someone needs oral surgery, you may be talking to the staff of the oral surgeon. Maybe you work in an oral surgery specialty office or a root canal specialty endodontist office, then you might be reaching out to the general office. So why do you want to be a dental assistant? Because you want to be part of a team. You're fascinated with patient care and dentistry. You enjoy a fast-paced working environment. You love talking to others. You get to work with many patients in a day and per hour. You want to help someone, and you want to be a dental care professional. You like working with your hands because we're moving and we're busy. So how do you become a dental assistant? So we generally would like you to have a 2.0 GPA because that allows you to have financial aid. You need to be college ready in reading. And so I think after this program, there'll be one of the advisors will be talking about how to do that. You'll need to fill out an application. The application is online, or you can contact your advisor. They can help you navigate that. And it's a 1-year certificate. So it's actually just a little bit under a year. And this is a financial aid eligible certificate. You get done quickly and then you're employed. Most health fields require health requirements and CPR. Students have to have a physical before starting in the fall. It does say include an eye exam, but that is not correct. I'll have to fix that slide. I didn't catch that till now. You'll need to have lab exams, and those are all listed, and those have to be completed before the start of the semester. The important part is that you start your hepatitis B 3-part series. That's for everyone, your protection and the protection of your patient, and you do also need the healthcare provider. How do you stay in the certificate program? You need to keep a 2.0 GPA. You need to at least have you need to maintain a C or better in every course. And you're able to readmit on a one-time only basis. Sometimes life happens. We've had students who've had to step out due to pregnancy, and they've come back because they wanted to finish. So we just add you into the next cohort. So it works out very nicely. So we have some requirements for our students because we have to look professional and we have to make sure that we're being safe. So students need to have 3 sets of scrubs and it comes with a warm-up jacket. They wear all white leather shoes, and we want you to have leather shoes rather than canvas because some of the products that we use, if they drop onto your shoes, they will stain and ruin your shoes. So the leather usually wipes off, but cloth would not. We don't allow visible tattoos or piercings from the neck up or the wrist down. There's no artificial nails or nail polish. And we talk about how to use proper personal protective equipment, and we call that PPE. You can see in the picture, we're always in a mask, safety glasses, and now a face shield. And we use a disposable gown and gloves. So again, this just is another view of the personal protective equipment, your mask, your protective eyewear, your gloves, and your gown. And like I said, with the new COVID, we're wearing a face shield. How to be successful. We do like you to purchase your books. You can rent books. There are a couple books that we recommend that you purchase just because they're very, very helpful. We have a flip book that has all the dental instruments, so it's really helpful for you studying for exams. Read the books. Not everything is on the test is covered in the lecture. Attend your classes. We have converted a lot of the classes to virtual, and we hold them synchronously so that you can be on there live with your instructor, just sort of like these Zoom meetings are. We also have clinical and labs. Ask questions. You need to review your material and then test yourself. Many of the faculty use Kahoot and Quizlet. Seek assistance. Be professional and be ethical. We do not tolerate cheating, so we want to make sure that our students understand that. So what is the time commitment for becoming a dental assistant? You need to have effective communication, so have a professional attitude, be able to be nice to your peers and your faculty. Ethics, we always keep stressing that, no cheating. We want you to know the information so you could treat your patients safely. You're going to need to self-study. There's a lot of, in some of the classes we're teaching you a lot of dental instruments, so you're going to have to study those. We even do some case studies. You're going to take a full load of 6 classes. So that's 18 hours a week you're at school. Many students work or have families, and so you still need to be able to study probably about 3 or 4 hours either a night or during the day, whether you're in the day or night cohort. And then at least over a weekend, spend about 8 hours doing some study. And here's our one-year curriculum. So there's 3 semesters. The first semester has the 6 different courses. There's 5 dental assisting courses plus HIT 125. You can take HIT, Language of Medicine, ahead of time, or maybe you've already had that prior to coming into dental assisting. Then your second semester will have 4 classes. In that class, in one of the classes, dental practice management, you will be developing a resume. And then in your third semester, you have 2 classes. One is a practicum, where you're going to actually work in a dental office, and we'll help set that up for you. And then there's a 2-hour seminar once a week that you'll attend, DAS 201. You will be, that's an 8-week course, and upon completion of that, most of our assistants are hired right into the practicum office, whether you do the specialty office or the general office. You spend, out of 8 weeks, you spend 6 weeks in a general office and 2 weeks in a specialty office. And almost all of our assistants are hired right in there. So we have a really excellent gainful employment. So we have 2 cohorts. So in the fall, we have an evening cohort. So they have a fall, spring, and then the summer is the practicum or an externship. Then in January, in the spring, we start a day cohort. So they start out with the spring semester during the day, a summer semester, and then they have a fall 8-week practicum. So what happens when you finish your certificate? You take a state exam. You apply for your state X-ray machine operator certification, and we give you all that paperwork and help you work through that, and then you get a job. And like I said, most of our students are hired right to their practicum. So how do you keep, if you get certified, then how do you stay as a certified dental assistant? Well, every year you have to have 12 credit hours, and you have to reapply, and you have to have your CPR every 2 years. Whether if you're certified or not, everyone has to have their their CPR certification every 2 years, whether you're a hygienist, a dentist, or a dental assistant. So for more contact information, you can contact Nicole Buchanan, who is our dental assistant coordinator. You can email dentalassisting@owens.edu, or you can contact me, and my information will be on the last slide. So let's move right into dental hygienist. A dental hygienist examines patients for signs of oral disease such as gingivitis and provides preventive care, including oral hygiene instruction and periodontal scaling. Periodontal scaling, scaling below the gum line. So you have to want to be very precise. So I'm going to give you a little video showing you about what our dental hygiene students do. And this is from our Give Kids a Smile. So you can see that busy people.
Today is Give Kids a Smile Day here at Owens Community College, where it's Ohio's annual event to give access to care to local communities. We do free cleanings, we do restorations, and we also provide fluoride treatment for kids who are under 18, all for free. So it's a really great way to reach out to the community and spread oral health care and smiles.
I'm a student here at the Owens Dental Hygiene Clinic. For me personally, it means a lot knowing that I'm going to make a difference in these children's life, caring for their oral health. Looking forward to working with Give Kids a Smile in the future and seeing what we do for the next years to come.
I'm going to show you a good brushing method, okay? You're going to have it kind of at an angle so that those bristles go into your gums. So you're going to vibrate it, and then you're going to flick off, just like that. Do you want to try it yourself? There you go. And then you go to the next set of teeth. You feel like you can do that at home? Good. And then you do your tongues, your cheek, the roof of your mouth, until everything's all clean and you get all that plaque off, okay?
So as you can see, that's the inside of our dental hygiene clinic. So that was like a little mini tour of our 21 chair clinic. And you got to see them doing a lot of really good work. So the duties of a dental hygienist, the dental hygienist is a prevention specialist, whereas the dentist is fixing people's teeth. And so the dental assistant is helping the dentist fix teeth that are decayed or broken or whatever. The prevention specialist is the hygienist. We're going to provide preventive and educational services. We're going to do periodontal therapy, which is taking numbers of your gums, called periodontal charting. We're going to use dental instruments to scale and root plane. We're going to use antimicrobial agents, which help kill bacteria in your mouth. And we're going to do dental cleanings. We can also administer local anesthesia, which in the picture, that's what the dental hygienist is doing. We also do oral cancer screening, and we promote oral and systemic health. When we do our dental cleanings, it helps reduce Alzheimer's, heart disease, diabetes, and infant mortality. Dental hygienists also remove tartar, we call it calculus, and stain and biofilm or plaque from the teeth. We apply sealants and fluoride to help protect the teeth. We also can take and develop x-rays. We assess our patient's oral health and report the findings to the dentist. We document our patient care and treatment plans, and we educate our patient about oral hygiene techniques and how to brush and floss correctly. So for the industry outlook for dental hygiene, there's 219,800 jobs. Currently, median pay in the Toledo area is $33.16 and $36.65 per the state. It varies regionally. Bigger cities sometimes pay a little bit more. And there's an 11% growth. And like I said, with dental assisting, the growth is actually almost double, if not tripled, because there's a lot of older hygienists and dental assistants that, due to COVID, feel that they may have underlying conditions, so they're getting out of the industry. So this is opening up lots and lots of jobs for all of our students. So where does a dental hygienist work? A dental hygienist can be a clinician. They can work in a public health facility. So in public health, they can either work in a public health clinic or they can manage a public health program. They can work in private dental offices. They can be educators and teach dental hygiene. They can work in a corporate dental office. They can be researchers. They can be a manager. They can advocate. They can do dental product sales and service, and they can be an entrepreneur. So just like dental assistants, there's many important qualities. Both dental assistants and hygienists need critical thinking. Dental hygienists must be able to assess and evaluate patients and develop an oral hygiene care plan. They must be able to communicate with the dentist and the patient about their status. Also, they must communicate with the rest of the dental staff, the front desk people and the dental assistants. Dental hygienists must follow specific rules and protocols, and depending on the state in which they work, they either can work with or without direct supervision of the dentist. The one thing I have it highlighted in red is dental hygienists must be able to work with their hands. Good dexterity is very, very important because we're looking at moving a sharp object very carefully underneath the gum line. So 1 millimeter of movement is very, very important. We work in tight spaces on small parts of the body, and it requires fine motor skills using precise tools and instruments. Dental hygienists work closely with the dentist. They must be considerate while working with their patient. So they must have good interpersonal skills, and they must be sensitive to their patient's fears and pain while they're undergoing treatment, dental treatment. They must also be good problem solvers to develop and implement dental hygiene care plans and to maintain and improve your patient's oral health. So when you leave Owens Community College, you will have, through the dental hygiene program, you'll have an Associate of Applied Science. You could go on and get a bachelor's degree. We have many transfer options and other programs, Ohio State and the University of Michigan, as well as there's many other schools who work hard with us, UT, BGSU, and Lourdes. You can also come back to Owens through workforce and get your expanded function dental auxiliary, and that's where you would learn to place dental fillings. So why do you want to be a dental hygienist? You have great dexterity and critical thinking skills. So if you're not sure if you have dexterity skills, if you play an instrument, or you do a lot of, you're very good at keyboarding, those might be things to help you. You do a lot of painting or crafts to know that you have great dexterity. You want to be a dental care professional. You're fascinated with patient care and dentistry. You enjoy a fast-paced working environment. You love educating others. You get to work with many people in a day or per hour. And you want to provide personal dental care. I'm going to skip the selective health requirements because that program follows this one. You do need health requirements just exactly like the dental assisting, and you must have CPR, but it must be for healthcare providers. And BLS is basic life support. To stay in the program, you have to have a 2.0 in all of your dental hygiene courses and all of the program courses. There's a readmit one time only. Dental hygiene is an accredited program. It's accredited by the Commission on Dental Accreditation. We had our last one 7 years ago, and we were pushed forward to 2022 for our next accreditation. Our students pass our national boards at 100% pass rate for the last I think it's the last 10 years. So being a professional, you need to wear your scrubs, a white lab coat, white leather shoes. Your hair needs to be confined and professional looking. You cannot have nail polish or artificial nails because we're wearing gloves and it could cause infections in your fingers. So that's not just our rule, it's the Center for Disease Control's rule. No visible tattoos. We're in a very conservative program, and your employers are very conservative. So that's what they're looking for. No jewelry from the neck up or the wrist down. And we require personal protective equipment, eye protection, mask, gloves, and isolation gown. So you got a picture from the patient's view on that last picture. So how are you successful in the program? Well, again, effective communication is important. Your attitude and professionalism are key. We need to stress that. It's very important. You're working to take care of another person, so you need to be professional. You need to follow ethics, and there's no cheating allowed. You need to self-study is key, or I'm going to use the word essential in this program. We have so much to cover in dental hygiene that if you get behind, you are in big trouble. So we have case studies. You are here on campus 20 to 25 hours per week, plus you need to study 5 to 7 hours a night and 8 hours minimum each night of the weekend to get a B grade. And if you don't believe me, you can ask the students. Time commitment. Classes are not optional. Your grade goes down if you're not attending your class. Classes have set hours. They can't be changed. There's no, you can't work all day and then come to dental hygiene. It's a full-time commitment. Failure to attend class will result in lowering of the course grade and may result in failure from the program. There are required evening classes. You can see there's a lot of courses. This is a 6-semester commitment. You start in the summer, and in this first summer program right here, there is one dental hygiene course, tooth morphology. So you will also have anatomy and physiology, nutrition, and statistics. If you've taken those prior, you don't have to take the tooth morphology. Second semester, you're very busy again. You're taking organic chemistry, and then you are taking clinical procedures, pre-clinic, preventive dentistry, oral anatomy and physiology, and dental radiographic imaging. So this is a very, very tough semester, and you need to really make sure that your study skills are really honed up by then. And then you move on to the third semester of spring. We also have another summer commitment. That's when you learn local anesthesia. And then another tough semester is the fall as a second-year student. And because you have 6 tough classes in there. And then by spring, this seems easier because you only have 4 dental hygiene program courses. There is sociology, and many students have already taken that course. So what does it take to be a dental hygienist? Get licensed. You need to graduate from an accredited dental hygiene program. We're fully accredited. You need to take board exams. There's a national board exam. There's also clinical boards. Then you apply to the state in which you wish to practice and take a state law exam. And then you renew your license every 2 years with continuing education. And that's 24 hours in Ohio. In Michigan, it's 12 each year, but you renew your license every 3 years. And you always need to make sure you have a renewed CPR. There's lifelong learning in dental hygiene. You do have to have your continuing education, any state that you work in, and then again, your CPR. We recommend that you join the American Dental Hygienists Association, which is your professional organization protecting the dental hygienist. If you have any more questions, you can contact me, Beth Tronalone, at Elizabeth_Tronalone@owens.edu. And I thank you for attending this and learning about dental assisting and dental hygiene, and I hope to see you soon as one of our dental hygiene students. Thank you.